I want you to know that I don't even let people crack my toes. I'll freak out if somebody cracks my toes.
Okay, we're doing that next.
Oh!
See, the thing is I don't really want to crack your toes as much as I want to show you that you can get over your fear. Chiropractic medicine. Okay, listen, I don't have to, but you really want me to crack your toes.
I might freak out.
Okay, that's
You're
okay.
gonna get a crazy reaction. Oh my god.
It's not. Okay, did someone crack your toes who you didn't like? Who was it, your dad?
My grandpa.
Grandpa?
Yeah, and he made me eat a really bad raw onion beforehand, and it was just...
He made you eat an onion, then he cracked his toes? Cracked your toes?
Yeah, raw onion. And like one of the spicy ones. Like the worst one you can have is a white, yellow. The worst one, the most potent one. He said it was good. He was eating it, and I ate it, and I tried to keep a straight face, and then he popped my toes. I just... All
right, hold on. Before I proceed,
yeah.
I'm gonna ask one more question.
No.
Okay.
No, he was a good guy. Very subtle.
Ready? Look, I just cracked your neck.
The neck isn't as bad as the toes.
What if it doesn't hurt though? What if
It's gonna hurt.
It doesn't though. Oh my god, that's so funny. Okay, can I crack you?
I have an actual phobia. It's like spiders. It's like you're putting a spider on me right now.
This is crazy. I've never
Oh,
seen
dear
it.
Lord.
Yeah. How about this? Can I do this? Can I crack your foot?
I don't know. I never had my foot cracked before.
Like that? Is that making you nervous?
It's making me very nervous.
All right. Maybe we'll skip the feet today. I mean, we should just... Ready? Hold on. Ready? Watch this.
Okay.
Okay, I'm not going to do anything yet. I'm just going to go like this. Good. You're looking right at me. It's fine. We can see each other. Nothing crazy's happening. You're nice and relaxed right now, so this is good. Just gentle.
Okay, that wasn't that bad.
Right. See, it wasn't that bad.
The toes are going to be bad, though.
This one won't be bad either. Okay, ready?
Uh-huh.
Pretty good. That was nice. Look how good you did. That was good.
That was great.
Here, make your neck straight on the things. I just adjusted it.
Huh?
Okay, ready? Look right into my eyes.
Oh, God, but I can't see my feet if my neck is straight.
Just
I can't see my feet if my neck is straight.
It's better that way. Just the little one. Just the little
The
one.
little one's the worst.
All right. Big one? I hear hesitation, which means maybe. Okay, so for the big one, I just go like this. You bring this down and then pull. See, the thing is I don't really want to crack your toes as much as I want to show you that you can get over your fear. That's the most important thing right now. This doesn't matter.
It's gonna hurt. I can't even crack my knuckles.
It's not gonna crack.
I
mean, it's not gonna hurt. I can't promise you that it's not gonna hurt.
Okay, but you have to count. You have to count.
All right, I'm gonna go like this.
No surprise counts.
I'm gonna go 3, 2, 1, crack.
Okay, on crack.
On,
or on one.
On crack.
On crack.
3, 2, 1, crack.
Crack.
On crack.
Okay.
I'm on crack. Okay. I mean, you're on crack. We're both on. No one's on crack. But... Good. Fear only exists in your mind. Ready? Okay. 3, 2, 1, crack. It didn't even crack.
I think it's because I tensed up.
It is because you tensed up. That's why counting's not a good thing.
Okay, don't count then.
Okay, I'm not gonna
Just hit
count
me with
this
it.
time.
Oh!
Look at you. You did it. Great job. That was amazing. You did it.
Oh! That was bad.
No, that was good.
Oh.
Did you feel how much
How
that
do
cracked though?
Yeah, but how do people do, like, how do people sit there and go...
Don't worry about other people. Who cares? Go put your legs back down. Everyone's different. Everyone has different, it's really about the constitution or the quality of your ligaments. That's what determines what you can crack and can't crack. Do you feel that in there? That really wants to go. But once again, look, you just accomplished that. You just faced a fear. It's important for you to recognize and acknowledge and commend yourself that you just did something that you were afraid of.
Okay, I faced a fear.
You did. Look, you just relaxed so much. You see how your body just relaxed and you just like sunk into that? That was good. Good job. See, it's the reaction.
It's really not that bad.
Yeah, exactly. Look at you.
Compared to like other things, I mean, yeah.
Okay, so that's a victory. We're going to leave it there.
Okay. Oh. It's a lot facing those fears, I'll tell you that much.
Are you proud of yourself?
I am.
Should be. It's important. It doesn't matter what you're afraid of. All fears are the same. You have to do the same thing every time.
All fears are the same.
Yeah.
All fears are the same. I'll remember that one. I'll think about me getting my toes cracked.
So this is these are organ of digestion manipulation. So it's like an adjustment, but in your belly. Okay, the first thing we do is the ileocecal valve. Okay, this is the window between the large and the small intestine. We find it by finding the belly button there and the ASIS. Your hip bone is right here. We're tracing from the ASIS up to your belly button 1/3 of the way. This is where we find the ileocecal valve. Yours is stuck. It's tender, right?
Yeah.
Okay, you're going to do some nice gentle breathing. Okay, and then breathe into your belly. Nice and gentle. Good. And then there's a reflex for this point. Okay, this is a valve. There's a reflex for this point on your second rib here. Okay, so here's the clavicle. We're going to find the second rib, okay? Here's the first rib right here. Here's the second rib right here. That's tender, right?
Mm-hmm.
Okay, these two spots right here are related to each other. So deep breath into your belly. Now. Okay, that's pretty good. Okay, it's not completely releasing, so we're gonna go to another spot now. Okay, this is called this is the gallbladder spot. So we're gonna find the middle of the sternum here. We're gonna trace down to the 6th intercostal space. Okay, and then the reflex for this point here is on your hand, in between the thumb and the first finger. Good, now we're going to hold these points. So again, deep breath in. Out. Okay, here we go. It's starting to move. Okay, we're good with that. That one's clear. We're going to tuck that in just a little bit. It's moving. Okay, the next one here is the damn snake around the rose, huh? What's it mean to you?
Dangers of love, but I also covered a scar up with it too, though.
The dangers of love. You know, that's the thorns of the rose are for, is the dangers of love. You had to go an extra dangerous, didn't you? It's a little tender, right?
Yeah.
Okay, no, so this is for the pyloric sphincter. This is found halfway between the belly button and the sphenoid, or excuse me, the xiphoid process. Did you have a big breakfast? You just had a smoothie, didn't you?
No, we ate breakfast at that B&B.
Oh, okay.
But it was like 8.
That's the last time you ate?
Mm.
Okay. Good, deep belly breath. And out. Good, deep belly breath. And out. Deep belly breath. And out. Okay. Okay, let that relax. What surgery is this?
Appendix.
Appendix?
Mm.
But your appendix is
Oh wait,
over
no,
here.
no, sorry. This one I have melanoma here.
Okay.
Melanoma here. My appendix was my appendix is down here somewhere. Honestly, you can't really see those scars that good.
No,
from my
right
appendix.
here. Yeah. This is different. They took your appendix out.
Yeah, and they looked at me, and I was 17. They looked at me after, and they were like, "Bad news is your appendix was perfectly fine, but the good news is your appendix was perfectly fine." And they sent me home way more sick than I was.
Just called them out.
Mm-hmm.
Just like,
Seriously, don't go there.
is it a teaching hospital?
No.
Okay. That's why it didn't release. It's because you have scar tissue here.
Oh.
It's because you had surgery. It's okay. It's kind of normal. You can do okay without an appendix. You have to eat probiotics, though.
I take my vitamins and stuff.
Okay. Okay, next part. This is the splenic flexure here. Okay, so deep breath into your belly. Good, and out. A little tender, right?
Yes.
Okay, again, same thing. Good deep breath into your belly. What kind of sickness were you
What do you mean?
when they took it out?
Like very sharp pains, like more in my pelvis region than anything, my pelvic region than anything. I ended up finding out later on that I actually had a lot of scarring going on in my fallopian tubes, though, which was probably the cause of concern for that. Yeah. And then I got diagnosed with endometriosis.
Okay, deep belly breath here. Going to contact your sternum at the top. Keep going, deep belly breath. Out. Okay, this is a pulse reading. Not Western medicine pulse. Western medicine uses the pulse for just pretty much rate. Mm-hmm. Even though they teach rate, rhythm, contour, and amplitude, do they still teach that? Mm-hmm. Okay, cool. So there's this thing though, is that but no one ever uses contour and amplitude, rhythm, contour, and amplitude. Rate is the one that they use.
Yeah.
Do you ever use contour and amplitude?
No, I've never used it. I mean, obviously, as a nurse, we're looking for your pulse, your rate.
Yeah, you're the one who takes the pulses. Doctors don't take the pulse,
exactly.
Right? So they teach rate, rhythm, contour, and amplitude, but they never really go any further. Okay?
Exactly.
That was a development from Eastern medicine. Okay, both traditional Chinese medicine and Ayurvedic medicine use a 3-point system. Okay, and the 3-point system is used as there's a superficial layer and then there's a deep layer, and it's used on both sides. And so each point, 6 points on each side, 12 in total, each point represents a different organ and meridian pathway. So on the right side, for example, in the superficial layer, it's small intestine, stomach, and thyroid gland. Sometimes, and adrenals too, thyroid adrenal here. And each pulse has a different characteristic, like the way that its contour is. So the contour for each of these, this is known as Vata, Pitta, Kapha. Vata, Pitta, Kapha. Vata, Pitta, Kapha. Each pulse has a name. Vata is, the characteristic of Vata is that it feels like a snake slithering through the grass. Pitta feels like a frog plopping into the ocean. And Kapha feels like a swan whooshing into a pond.
Okay.
Okay, you can't feel that. That's what you feel when you put 3 fingers on the pulse, though. I thought this was nonsense when I looked it up and I was reading about it, and I was like, this is crazy. But then I tried it out because I had too many people tell me how good their acupuncturists are at diagnosing things with a pulse. Like I had multiple people be like, yeah, I had a gallbladder issue, and the pulse, my acupuncturist read the pulse and diagnosed it properly. So I was reading about it and I thought it was nonsense. And then I just asked a patient, I was like, you mind if I take your pulse? And so I spent a couple minutes like figuring out like how to get all 3 fingers to feel a pulse. And then I was looking at the book, and as I was looking at it, and I was like, okay, let's see, this one's supposed to feel like a snake slithering through the grass. And as soon as I like concentrated, holy shit, this feels like a snake slithering. It's just like, it just is a thinner pulse, and it has a little wiggle to it. And then this one in the middle, a frog plopping in a pond. Boom, it feels like it every single time. It's just one fat pulse. And then this one feels like a swan whooshing in a pond, and it just feels like you can feel the movement of it, right? You can feel the contour of it. So it's mentioned in Western pulse reading to take contour, but it's only in Ayurvedic and also Chinese medicine that they actually use it for anything.
That's very intriguing.
Okay, so I assume with endometriosis you don't have a completely normal period?
No.
Are you on birth control?
No.
Are you on any other pharmaceuticals?
No.
What vitamins and minerals do you take?
I take like a woman's supplement and collagen. I think it has like vitamin C, D, a lot of different vitamins in it. And then I also take, I actually haven't been taking my probiotic, but I was taking probiotic, but then I ran out. I don't know if those women vitamin things I take now have that in it or not, though, because I just got those.
Probably not. Okay, ready? I'm going to palpate the inguinal ligament with your fingers, okay? We're just going to test the pelvic cavity here. Let's see if we can get this here. Okay, so this helps. This is the border of the pelvic cavity, so it lets us know if there's any abnormalities here. Any tenderness? This feels pretty good. I don't feel any abnormalities. I don't feel a whole lot of lymph nodes. Just a little bit right there. A little bit of tension on that one. These 2 fingers. More or less tension on this side?
It's less on this side.
Okay, you put that there. So you have long periods? Here, tuck those underneath.
No, not really. Like my periods, really my cycle is short is the red flag with it. Like my cycle is only about 20 days long, but my periods only last about 4 days.
Okay.
It's just like day 1 and 2, it's just it's very painful. Like it's enough to make me puke, usually. Okay. So it's just very painful, but other than that, it's not terrible.
Okay, let me see your fingers again, both sides. All right, now the reflex point for the ovaries and the tubes is just beneath the ileocecal valve. So here's the ileocecal valve, and then we need to go underneath right on top of that ligament right there. So you're just going to hold that, take some deep belly breaths. It's tender on the right? That's right, yeah. Okay, you're breathing. Good, and out. I want you to massage these points whenever you're having discomfort, okay?
Mm-hmm.
You all right? Just 2 minutes. Okay. You can do that though. If you do that, especially during times of discomfort, it'll help move things. You know, things get stagnant, especially with EM. Things get stagnant, so the fluid needs to move, all the swelling needs to move. Have you ever been on birth control?
They've tried to get me to take. I just refuse.
Right, yeah.
I'm not a big. I don't even take seizure meds. I'm just not big on supplements. Like even for vertigo, like what they tried. Is it called pronounced meslazine?
Mm-hmm.
But I just take ginger.
Okay.
And it works.
That's good. Very gentle manipulation. You're going to smile. I'm going to take your maxilla, right, your upper jawbone, and we're going to move it in that direction.
Okay.
Okay.
I'm scared. Like, am I smiling with my teeth or just normal?
Just like that. Yeah. Huh?
Okay.
Okay. Now relax your smile. You don't have to smile anymore. Okay. We're just going to hold that just like this, and then the bridge of your nose, and we're just going to very gently hold it just like that. You feel that?
Mm-hmm.
Okay. Let's see. So we usually test it against the pressure of the other side. Does it feel different from right to left?
A little.
Okay. And we just have to hold this like this while you breathe. Respiration does the adjustment during cranials. Every time you breathe, your skull expands and contracts just a little tiny bit. That expansion and contraction helps pump cerebrospinal fluid throughout your brain and your spinal cord. Good. Try like this. You have any sinuses, allergies, sinus issues, allergies?
Mm-mm.
Okay, one more time, smile. Very good. I know that's super weird, but it's okay.
I felt like I was at the dentist.
This is the sagittal suture here. I'm going to hold the occiput in the back and then the parietal in the front. Or on the top. And then the parieto-temporal suture. We just very gently check the sutures for any bumps or gapping and tells us whether or not the cranials are chronically smushed together or pulled apart. Just a little bit on this right side.
Yeah, it feels tender right there.
So we're just going to do some very gentle tapping. Really, sound meditation is important because the sound is the vehicle for your mind and your thoughts. So as long as you're in the moment, as long as you're listening to the sound, that means you're present in the moment. And the present moment is the most powerful time, most potent opportunity to actualize your intentions. They call that manifesting your reality these days, but actualizing your intentions is more realistic. So there's going to be a couple different sounds. I'm going to do this. This is like the rattle. And then I'm going to do this. It's like the drum. Okay. Nice, gentle breathing. Nice, gentle breathing. Nice, gentle breathing. Just follow the sensations of your breath. Feel your body expanding when you breathe in, releasing as you breathe out. Focus on the spaces in between the breath, silence and the stillness.